This is me at one of the clinics I'm working in, and a patient with HD. I am a dental hygienist. I've been working as a dental hygienist since 1985, and all the time I have worked with persons that have disabilities of different kinds. So when I met the first person, when I met with Huntington's disease, I felt this is something very important, and that's something I have engaged me in a lot during the years. I am also chairman of the Swedish Huntington Association. So you understand that I think this to help persons with HD is very, very important. So I spend a lot of time doing this. And a couple of years ago, I was invited to have a workshop in Bucharest, and I met some persons there that I think got more interested in oral care. And now this time I'm doing it again, and I hope I can lighten up your thinking about oral care a bit. But the question is, why care about oral care? Why should we care about the mouth and what's in it? That's something to think about. As you all know about the symptoms that persons with HD has, they have psychiatric problems, they have cognitive impairment, involuntary movements, balance difficulties, lack of patience, dysphagia, and so on. There are many things that affect not only the life otherwise, but also the life, the things about the mouth. And sometimes persons don't think that the mouth is a part of the body, but it's the same blood in the mouth as it is in the toes and in the knees and in the heart. So it do affect, and from a little child to the old man or woman. And as you all know, we do a lot of things with our mouth. We breathe, we drink, we eat, we talk, and we socialize. So that's something to think about, that is very important to have a good function in the mouth. And what about the oral health among persons with HD? I don't know how well you know how many persons with HD you have looked into the mouth or helped with oral care, but I will show you some of them. This is photos of persons that I've met during the years. This is only some of them, but you can see that it's a little bit different. Some look rather good, I think. You see when I point now? Yeah, good. And some doesn't look so very, very good. So it's different. But the aim, I think, for us is that we want to help the persons with HD to have a good oral health, no problems, no aches, and so on throughout life, because the disease it's so much that affects otherwise. So I think if you can see to the persons that they don't get problems with the mouth also. It would be very, very good and very important. But I think, and I know that this is something hard. It's very intimate with the mouth, and perhaps the person doesn't want to open it. And here are a lot of things that can happen with the mouth. You can get toothache, you can have eating problems, the persons would be malnutrited, he can have poor oral hygiene and pain and sensitive root surfaces. It makes social problems. Some have tooth grinding. Some have problems while they're brushing, it hurts. And some persons have problems with the self-cleaning. You know what you do when you have eaten, you can take the tongue through on your teeth to get rid of the food that are still there. Some have chewing problems, some have gingivitis, blisters, bleeding, broken teeth, speaking difficulties, and some refuse to receive help. I guess this or many of these things happens to all of us, of course, that we could have toothache or we have problems with tooth grinding. For instance, I use a splint every night because I grind my teeth, but sometimes it gets very, very much grinding, and that could make problems.
Sorry, grinding, Annette, is that when it's icing in a way? It's really...
grinding is when you are doing like this, grinding. You know, you are you know what I mean?
We call it bite your teeth in Norway.
Bite your teeth, but you do it like squeezes your teeth, and then I will show you some pictures later what can happen when you do it. Other problems that could happen is that you lose the contact with your ordinary dentist. You don't visit the dentist anymore. You are not able to contact the dentist, and you have problems because you couldn't work anymore, so you don't earn any money, and that's a problem because often it's cost a lot of money to go to the dentist if you don't have support. And you can ask, if you see those pictures, is this quality of life? This pictures is from a man born 1973, and you can see the picture on the left side from 2004, and then on the right side you see the picture from 2016. And when I see it, it hurts. And this is a man with Huntington's disease and much psychiatric problems. So he refuses to come to the dentist. I met him 2004 when he looked like he does there, and that if he had been able to come often, we could have kept his oral status in a much better way than it got, because he didn't want to come, and he didn't care about his teeth either. So it looks like this, 2016, and now I think he is going to the dentist, but it's very, very hard to get him there because he is a little bit afraid also, and that's a problem too. Here is another person that looked like the picture to the left when we met him the first time. He was around, I think, 45 years old, and he had the problems. He didn't care about his teeth either, and he had frequent meals because he loved cakes, so he ate a lot of cakes, and he was dry in his mouth, and the teeth just broke. But after he had no problems in coming to the dentist, and he got general anesthesia and got help. So he looked like you see on the right side after the treatment. So it could be good. What is the consequences, and what are the consequences in the oral cavity? You have all heard, I think, about gingivitis, what that is. That is something that most people have sometimes, but because of bad or poor oral hygiene, problems with brushing or cleaning between the teeth in the right way, then you can have gingivitis. So this is the mouth from a woman with HD that I met several years ago, and she didn't want to have any help. She lived with her husband, and she tried to brush her teeth, but she didn't succeed so very good. So she had problems, and it hurt. It hurts a lot when you have gingivitis, and then you don't brush in the right way, because you avoid the hurt, and then the problems get worse. And the gingivitis might cause periodontitis, when you can lose your teeth. That doesn't happen always, but it could happen if it goes deeper in the gums. So this is a mouth from a woman. It looks rather good, but when you take the probe, you find that the pockets, that's the teeth is in the bone, sitting in the bone, and when the bacteria is working and breaks down the bone and the tissues around the teeth, then you get periodontitis, and then you get pockets, and that is very, very hard to clean for yourself, and you get calculus and lot of problems. And if you don't get treatment in right time and get good oral hygiene, you could lose your teeth. So on the right side, the picture to the right, you see what happened. She lost most of her teeth, and then she got dentures, partial dentures, but that was very, very problem for her, of course, because it's hard to put in and take out, especially if you have a lot of movements. So that is not a good solution, to have partial prosthesis or partial dentures. I talked before about calculus. Calculus, you get, it's rather common to have calculus for each of us, and often you get the calculus in the lower jaw in the front, or in the upper jaw on the sides, because you have the saliva saliva nodules. Don't know what that is. So the saliva produces and comes out on the tongue and on the sides, and then you can get calculus that you see, and that is important, of course, to get rid of. And this is the mouth of a man with Huntington's disease that has calculus and also caries. And this is when there is a lot of calculus. Of course, you have a bad breath also when you have this lot of calculus. So it's important to have the daily care. Someone want to ask something, or is it all clear? Yeah.
Anybody want to comment? No.
No.
It's clear.
Yeah. Here you can see what has happened. This person has got caries also close to the gingiva, on many of his teeth, and that is because he hasn't brushed his teeth and he has had frequent meals. And it's very important when brushing, you shouldn't brush just here on this surface. You must put the brush on the right side, on the right spots on the teeth when you brush and when you clean between. This is very important to keep a healthy mouth. And that, as I said before, is what we are aiming for, as healthy mouth as possible. If you have brushed too much, you got this injuries on your teeth, and this surfaces, the root surfaces, is much weaker than it is on this surface. So on the root surfaces, it's much weaker. So that's if in
So
the
this damage on the right hand is caused by brushing too hard. Is that what you're saying?
yes, brushing too hard. Yes. And that happens to all of us also, but perhaps not so much. But it's very common that you get these wounds, especially on the teeth. What you say about the teeth in the corner, the canines, we say, call them also. So if a person, the persons with Huntington's disease, they have increased metabolism in the cells, they have involuntary movements, and that makes that they need more calories. And many of the persons that need more calories, they eat wrong. They eat often, and they eat perhaps candies, cookies, and so on, quick calories. And then it's very important to support with oral care. So you have to support so you don't get much damage. Several meals and dry mouth, that is also a big problem because of the medication. Many people get a dry mouth. Also because of many persons in late stages, they don't close their mouth. They have the mouth opened, and then they breathe through the mouth, and it gets very dry in the mouth, and then it's more easier to get caries. I guess you all have eaten some cakes, and this is a special cakes that is very special if you are dry in your mouth. When you chew it, it makes like more. What can I say? Not porridge, but it's very hard to get off the teeth if it's there. So if imagine that there you can't get it off, it's still there all the time. So the person needs to get help to get it away from the teeth. And here is the person. You can see he has impaired oral motor control. And he is rather young also, and you can see that he is not moving his tongue inside his mouth as he should do. He has already problems with this. And I said that also before, if you put your tongue and make that move, you can understand that it's very important that when you have eaten, you do that automatically. But if you can't do that automatically, the food stays in the mouth, in the teeth, and it stays there until you clean the mouth. That's him again. And it can be like this if you have impaired motor skills. The food stays in the mouth. And then it affects the teeth, and it also affects the mucosa, of course. in the mouth. You can have problems with wounds. And another thing about the involuntary movements, then you can have problems with bite injuries. You can bite yourself in the cheek, and if you have done it once, you often do it again. I guess you all have bitten yourself sometimes in the mouth, and then it's very easy to get there again. So that is the wound that has become like hyperplasia. The mucosa has it has become like an extra mucosa, an extra notch on the mucosa. And here is a person who has been grinding, as I talked about before. You see the teeth are smaller, and there has been a hurt in the lip. The person has bitten herself in the lip. And here is a person who has bitten himself in the tongue.
All this looks really painful, Annette, is it?
It is very, very painful, and a big problem, because how to stop, how to help the person, that's not so very easy. But this person who had bitten himself in the tongue, the dentist, he put a suture here, and then he got a splint, a soft splint that he had daily. He took it out when he had meals, but otherwise he had it daily, so that the wound on the tongue would heal again. That is things that happen with persons with HD. And here's another person with HD, also a woman. She has a bite injury here in her inside of her chin. No, not chin, cheek. And on the mucosa here, and she got also a soft splint that she could have to avoid biting herself again. This is not so very difficult to do, but of course, when you have to make the pressure or this model, and then afterward the technician makes this splint. This is a process that's not so very easy for everyone to stand out for. And here you can see very much problems. I haven't seen many, but this is a woman with HD, and you can see here on the teeth in the lower jaw that she has been grinding so much that it's on the skin. And of course, this is very much hurting. A great problem for the person. Today, she hasn't got any teeth, but often the dentist, that is not something you would like to do, to take away the teeth. It's the finish, or the last thing you would like to do is to take away the teeth. But sometimes there is no other solution. But it's good because it doesn't happen so often. Dry mouth. Dry mouth is a problem, as I said, and I said that before. The woman that is don't close the mouth at all. She is all the day it's open, and the lips get very, very dry, and it gets very dry in the mouth also. And it's problems with, of course, to swallow when you are so very dry in the mouth. And it's, if a person have dentures, it's very, very big problem that the dentures will sit good in the mouth, because it needs saliva to fit to the mouth and not to loosen. Of course, it's also very, very difficult to speak when you're dry in the mouth. that we all know about how it is when you are dry. And here you can see the tongue. It's like the desert, very, very dry. I will tell you about solutions for this later. Of course, if a person has a dry mouth, the risk to get caries is very, very much increased. It needs to have, we need to have saliva in our mouth. It's very, very important because the saliva consists of many, many different kinds of systems that can heal if there has been a beginning to be caries, it can heal again. But if you are dry in the mouth all the time, then it becomes caries from it. Another thing that can happen with persons with Huntington's disease is that they don't have too little saliva. They have very much saliva, or it feels, we find and we think that they have more saliva than others have, but often is the problem that they have swallowing problems. Therefore, they don't swallow the saliva, it comes out instead, and you can see it on the chin. And I just the other day I got a question about this. What can we do about the person that is drooling so much the saliva comes out? But I think it's not the problem that it's too much saliva. It's the problem that the person can't swallow. So here, glands, that was what I was looking for. The saliva glands you see on the picture here, the big saliva gland and the smaller under the tongue. And here is something that you can use if a person have a lot of saliva that comes from the mouth. It's to protect the clothes. You can have like this, like a scarf in special material that takes up the saliva when it comes out. It doesn't look so very nice when this person has a lot of saliva coming out from the mouth. Something that many of the persons have is that they have parenteral nutrition. And if you have the person have parenteral nutrition and don't eat with the mouth, there is still a problem, and there can still not be so much caries perhaps, but there can be a lot of calculus. You can see here the calculus, and also it can happen that the nutrition solution comes up as a reflux from the stomach into the mouth. So even if you don't eat with the mouth, it could come, the nutrition solution could come up in the mouth and cause caries problems and cause wounds on the mucosa and so on. So it's important to see to if when the person gets the nutrition, does it come up or does it stay in the stomach and where it should be? What also can happen from the reflux when you get acid from the stomach up in the mouth because you have problems with the dysphagia is that you can get erosions on the teeth. It's something that persons, example, with anorexia has when they have a reflux. It also comes up, or persons who drink a lot of you say carbon dioxide, like Coca-Cola and so on, then they can have problems like this also with erosions in the teeth. It looks like caries. And also when the acid comes up from the stomach, you can have problems because it doesn't feel good. It burns in the mucosa and you can get sores and blisters from that also. I told you about calculus before, and when the person is in the late stages and has a decreased oral motor function and not so dry in the mouth, has a lot of saliva, then it is like the teeth is bathing in the saliva, and many of those persons get a lot of calculus, especially on the inside on the lower jaw, and that is a problem because many times it's hard to treat those persons in late stages, and since they have the dysphagia. I am, as a dental hygienist, I often use water when I take away the calculus, but on these persons it's not so very good to use water because of the problems they can aspirate while treating. So this is really a problem. Persons also get sores and blisters, and that is also, of course, a problem. And I think it's very important for those who perform oral care that they look into the mouth, look inside. How does it look? About the teeth, about the oral mucosa, and see if there is some sores or blisters, because if it is a person that still is eating with the mouth, then it could be like the person doesn't want to eat at all, refuses to eat, and that could depend on that he or she has blisters, one blister or several blisters in the mouth, and that hurts so much that they don't want to eat. So it's important to look inside. Don't think it could be very easy. It doesn't have to be something big. It could be like I said, like a blister, and there are medication for that you can put on to make it more easy to eat and also to talk. It could be hard to talk or to perform or oral care if you have blisters in the mouth. So just a flashlight. I mentioned dentures before, and that is really a problem because it's very hard to balance dentures when you have Huntington's disease, and especially also those with partial dentures. It's a lot of problems. You who are listening to me now, do you have met those problems that I have talked about? Do you help any persons with the dental or the oral care? Have you looked into the mouth?
Yes, I do it.
Yes.
I brush our teeth with my wife, and we have a problem with biting,
Yes.
but it's over because there was with one bad teeth, and we have to put it out. So now it's okay. She have a problem that teeth rise up in this way, and it was on the tongue. So when he eat or speak, he bite on the tongue. It's over now, and I use electric toothbrush and mount water.
Yeah.
What we
So
do, but it's a great idea. I have to use this flashlight and take a look.
yeah. So now I will talk about what can we do to prevent and to support. What is very, very important is for the person in the early stages of Huntington's disease is that to be reminded that there is a appointment at the dentist. That's the first thing. Some of them have those schedules telling about that tomorrow you will go to the dentist, and perhaps helping them to come to the dentist also. And you, as if you are a relative, or if you are a working person that is where the person is living, you can follow to the dentist as a support, because often it's problem that the dentist or the dental persons working there, they don't know anything about Huntington's disease. So you could be a very, very good help in telling them how does this person react, or what to think about, such as the swallowing problems and so on. And also as a support to, perhaps if you get instructions how to do, you can help to perform that at home. So that it's very, very important, I think, just to tell us how does this person react, or what shall I think about. And me as a caregiver, it's always very, very important to ask, of course. That's something we should do, ask, but it is not always happens. And the doctor or the nurse or the welfare officer, they need to ask when they meet the patient with the Huntington's disease, do you have an ordinary dentist? Often the person say yes. Okay, then you have to ask, when was the last visit? Because that could have been 10 years ago. I have a dentist, but I haven't been there for a long time. So it's very important to ask the right questions. And how often and what professions do you see a dentist? Do you see a dental hygienist? And do you have any problems with your oral health? I think it's important to see how does the person perform oral care for him or herself. And something you also can ask, is it possible to get financial support? In Sweden, there is possibility to get financial support for persons with Huntington's disease. So that when they come to me as a dental hygienist, they pay about 10 euros. And when they come to the dentist, they pay 20 euros. So that make it possible for the persons to come. The money doesn't matter for them. I don't know, in your countries, do you have some support to your patients when they go to the dentist?
I'm speaking from Portugal, and here we don't have free dentists. I will always pay, unless you are attended in hospital. Otherwise, it's all paid, not in our Service National. So it's not in our service of health system.
Do you say that you don't get any support?
No, I last week I went to dentist. I always pay because I have universities where the cost of is lower, but you have to pay the same. It's lower.
Okay.
And, if you go to the university in Porto, the cost is lower, but isn't we have always to pay.
So the money is a problem.
Yes.
Yes.
We have that problem. I'm unemployed and divorced, and I have to pay my dentist because I have a problem with my teeth.
You have problem yourself with your teeth?
Yeah, yes, it breaks easily, and so every month I break a new teeth and I go to the dentist a lot of time, unfortunately.
Yeah. Do you have problems to brush the teeth yourself?
No. For now, I discovered 1 month ago this disease, and I'm always get going to the dentist. For now, I don't have that problem.
You don't have problem now?
For
No,
now,
no.
no.
As I said before, the daily care is the most important thing
Mhm.
that you do at home. That's very, very important to avoid so as much as possible to get problems, of course. But then as I also said, you have perhaps the problems with the dry mouth and so on, and then you have to support in some way.
So,
Okay. As I said before, in Sweden we have this economic support, and I know that in Norway you also have this support in some way.
Yes, if you are diagnosed with Huntington's disease, you can get dental care free of charge, more or less.
Yeah,
Very, very cheap, at least.
yeah, that's very good.
Yeah.
That's very good. Questions to ask at the dentist is, of course, do you manage to brush your teeth and keep clean between your teeth? And show me how you do. When you, it's very, very important. We shouldn't be satisfied with the person saying, I can manage myself brushing the teeth. We need to see how it's done. And also ask, what do you eat and what do you drink? Because if you have problems in chewing, then perhaps, or then it's very common that you have problems with the teeth also. And now we will see a short video on a person with Huntington's disease that still is doing her oral care self. Not so very satisfactory. And that is, as I have written there, time to deliver the message. You need help with your oral care. That's a hard thing. That's a hard thing to tell someone. You can't manage to do it anymore yourself. You need help. And for this woman, she had her husband with her, and that is not so very easy always for the husband or the wife to help the other with oral care, something that you never have done before. Suddenly you should help someone by your side to clean the teeth and so on. That's not easy, and it's not very, very easy either to accept this for the person, that to take help from someone else. So in this time, when I met her afterwards, she refused to take help for around a year, I think, but she came to me once a month for support as a dental hygienist. So I helped her, and then after around 1 year, she was prepared. She was ready to take help from someone else to clean the teeth. It's also important when you're telling someone if they still can make the oral cleaning themselves. It's important since the person has a lot of movements. It could be easier if they sit down, if they get a chair in the bathroom, and they can sit down, and then they can lean to the sink and with their hands and and brush. It could be easier if they get support and they don't have to think about the body also. It's very easy to hurt themselves if they use a electric toothbrush, for instance. It's very, very hard, very, very easy to hurt themselves. So perhaps that isn't the best thing to use. That was the film again. Up, up, up. Something we also use is support with pictures. Pictures that can help the person to remember how to do. This woman we met a couple of years ago, and she got this support to remember her to brush the teeth. She used a double action toothbrush. I will show you that later also. And then she got a grip enlarger on the brush handle to hold it better. And she also got this mouth angle expander to see her teeth while brushing. So she had this photo in the bathroom on the mirror to remember to brush the teeth. It was in the early stage. This is also some kind of picture support that we can use to tell the person that now we are going to brush. Here's the toothbrush, here's the mouth. Do you have ache in your teeth? And you can use this. It's a simple point and talk pictures you can do for yourself. You can ask, is it problems with eating? And then they can point on this, for instance. Yes, it's problems. Here's another picture support for prepare to brush that can make it easier perhaps for the person to understand what is going to happen. Sit down, as I said before, that you take some lubricant on the lips to make it easier to open, and what things you use while you brush. I will soon show you a video about this also. There is a special picture database on the net that you can go into. It's not only in Swedish, it's also in English, and it's called bildstod.se. There you can find these pictures if you would like to do your own. It's free, it doesn't cost anything. This is also some kind of support that I have given to carers, that they should stand beside the person while brushing and to support the head, to stabilize the head, to make it easier to brush or to clean between. It's very, very important to have a good working position. So this is a support that I gave the carers for this person that they had at home. There were often, there are many carers at the same time, and it's one of them gets the information at the clinic, and then we can take pictures, and then we can support them and give this so they can have that at the nursing home or at the home, wherever. But many times I think when I ask carers, how do you do when you brush the teeth? Or very, very often they stand in front of the person. They are going to help, and the head is going like this, no stabilizing at all, and they don't see what they do, and it's very, very hard to do it. So I think if you're going to help someone with the oral care, it's very, very important to do this as right as possible, because this is difficult. It's not easy to help someone with the oral care. It's difficult. It's dark inside there also, so you don't see so much.
But what you do here is really you have the person you are supposed to help or going to help to sit down, so you are really You could stand. You're a little bit taller in a way also, and have a better position, I guess.
Yes, that's absolutely the best thing. And they can sit in the, for instance, the Huntington special chair or in the wheelchair, but always that you have this thing that you put the arms around the head and the hand like this to stabilize it. I think it's very much more comfortable for the person also. It feels more secure to have this. You grab, not light. You take of course it's comfortable, but you do it so it feels good, and then you stabilize and you can make a much better job. This is something we did for a person who had a lot of movements. His hands went up all the time when he should get help from the carer. So I brought one of my son's footballs, and he sat by the sink. He liked football a lot, this guy also, and I asked him, please could you hold the football? So he focused to hold the football while he got help from the carer to brush the teeth. And this is when a person gets treatment at the clinic. The person, of course, can't lie down like this, as it's good, the best for us treaters if the person lies like this. But if a person has problems with swallowing and so on, you can't treat a person like this. You have to have a better position, of course. And I also, as a dental hygienist, I get assistance from a nurse when I'm working, if it's difficult. That's not always common.
This is really important, Annette. I'm thinking now that you're talking about it, that if you lay down, you have problems with swallowing, you feel you get suffocated, you don't manage to breathe.
Yeah. We as a treaters must adjust for the patient, not the other way around. It's very important. This is a person, she came to us 2001. It's many years now. It's 20 years ago. She was almost the first person or the second I met with Huntington's disease. And she looked like this. It was very, very good. She was really caring for her teeth. Some years later, she looked like this. She had gingivitis. Still rather good, but she had gingivitis. She didn't manage anymore to perform oral care. And then she got a little support at home. She got support daily at her home. And then I told this person how she could help her with cleaning between and so on. And they did. And then this person got very, very sick in her disease. So we lost contact for a time. And when I met her then, she looked like this. And you see, she got a wound in her lip, and her teeth was not looking good at all. I think this was some kind of medication that made them so very dark and so on. But I cleaned her teeth, and I helped show the persons how to do. And this is picture taken. You see, that was 5th of September, and that was 28th of September. And she looked like this. Do you think I was happy?
Yes. Hard to believe possible.
I was very happy because the carers had understood what important it was to help this woman with her teeth. Of course, I did my share, but when I had done that, it was the daily care that was important. So that when a person looked like this, it isn't, you can get it better again. And now this person, she still lives, but she is She is, of course, in a very, very late stage of her disease. But they still help her, but she has the problems, as I said, with the calculus inside the lower jaw because she has the saliva and poor oral motor function. So that the teeth is bathing in saliva, so she gets a lot of calculus, and that is a problem, because it could happen that she could aspirate, and that we don't want to happen. But still, she has rather good oral health. Do you being tired yet from all those terrible pictures, or can you take some more? This is the mouth of a person, a young person. First time I met him, he was around 20 years old, and he looked like this. He had gingivitis, bleeding, hurts, a lot of bacteria, plaque on his teeth, where I said before, just in next to the gingiva. There he didn't brush. He brushed his teeth when he was going to do something, such as going to the movies or something like that, and that meant that it could take about 2 weeks for him. He brushed perhaps his teeth every 14 days. He has lost. He had the early juvenile Huntington's disease, but after a while, at first he got daily support, and then he got better support. He had assistance during the whole day, and this assistance were fantastic. Perhaps you don't think it looks very good, but no gingivitis, no hurts. The caries that was going to be caries that you had to mend, they healed because of the good oral care that he got from his assistant. I think this is like I get very, very warm in my heart when I can see that, and I can say to the carers that you are the best. You have done this. And he didn't have problems with his teeth. He didn't have to go to the dentist to heal or to drill or to do anything. They manage. He come to me every 3rd month for a checkup and for support, and I could say you are the best to his staff. And even since he got worse and worse in his Huntington's, they still acted as they had done before. And I think that's very important, to not stop. You do it from as soon as possible, and then you help to keep the good oral care for all your life, because then you don't have to get those problems. Are we going to continue? Have a break, or what do you think, Astrid?
Yeah, no, I wasn't planning for a break today, but I don't know how much more you have to share with us, because
I have a little more to say, not so very much, but
okay.
Can you manage, you who are listening? Is it okay that we go on?
For me,
okay.
Yeah.
Yeah.
Me, yes.
Then we will see a little movie here again. This movie we made, and we have it on our the Huntington website in Sweden. You can of course visit there and see the movie. You also, if you want to share with someone else. This is the assistant performing oral care on this man with Huntington's disease. It's an instructing video. No, he is talking, I think if he's saying something, he is of course talking in Swedish, but it's what he does that's important. He prepares with this picture support. And then this man has a special working chair he is sitting in that he can put a little bit higher, so it's easier for him to get the right level to get the right working position.
Why do you put on this before you start?
Because it's easier to get in through the mouth if the lips are not so very dry.
Mm-hmm.
We use this thing a lot, the mouth angle expander, so that the assistants can see the teeth while they are brushing or helping with the oral care. Then he's using a double action toothbrush, which brushes all the surfaces at the same time. And you see he's holding his hand back so he can stabilize the head.
Because this patient doesn't have, or this person with Huntington doesn't have a lot of movements there.
No, he doesn't. He has more now, though. Now he's cleaning between. They do that once a day. And then he is using a lubricant. This person doesn't need that actually, but this is for showing how to do with the oral wipe.
You
It
can
could
buy
also
that
be
at the pharmacy, or
yes, or you can buy it from the web. The producer is called Proxident, and they have a website, and then there you can buy wherever you are in Europe. And if you don't get that contact, we also, where I work at Munho Center, we also have a web shop where you can buy those oral wipes. They are very, very efficient. So here you can see the double action toothbrush. It has the bristles are bent. So when you put it on the teeth, they come at the right spot, as I have told you many times now before, to get to the right spot close to the gingiva when you're brushing. That's the most important spot you should reach when you brush the teeth on someone else, and yourself, of course. And then the mouth angle expander. This thing, it's not so very easy to get hands off from an ordinary web shop, but you can buy them from us at Munho Center in Sweden. And there are other kinds of those things also that I think you have in your countries also.
is it expensive, this expander?
It costs, let's see, 15, around 15 to 20 euros.
Okay.
But you each time you clean it and then you use it again, and it lasts for many years. I haven't had many that was broken. But you have to learn how to put it inside to use it. Here you see the brush with the bristles that comes right on the spot. And here are electric toothbrush. Of course, that's the things that you can use if you're helping someone else. But as I said before, it's hard when a person is going to brush himself when they have movements. In Sweden, we have a special toothpaste with more fluoride in than a common toothpaste. I don't know if you are familiar with this one. An ordinary toothpaste has 1,500, call it in part per million fluorine, but this toothpaste has 5,000 part per million fluoride. So it's good for those persons who gets a lot of caries to support. And here are also some bite support that you can have use when you're helping someone with the oral care if they don't open their mouth, or if you risk to be bitten while you're helping someone. And this is a mouth opener that you also can use to keep the jaws aside when you're brushing. These are unbreakable mouth mirrors. That is good for the dentist to have if a person bites while the mirror is in the mouth. And cleaning between the teeth is, of course, important for all of us to do it daily and to use the right thing that fits between the teeth. It depends on how big the spaces between the teeth, of course. And here, fluoride is very, very important to support and to help the person to not to get caries. We also use a lot of antibacterial toothpastes. This is special with chlorhexidine and fluoride that is made from gum. Gum is something that you can buy all over Europe also. Gum is the product name. And this is also a very good support for those persons who have gingivitis. And this is a solution that is antibacterial solution to use if there is a problem with the gums also. But often persons with Huntington's disease have problems with what do you say, rinse the mouth. Then you can use those Proxident oral wipe to put the oral wipe in the solution, and then you can put it in the mouth to get it around. And here is also something we use. It's also antibacterial to support. Here you see the oral wipe in action, and you can dip it in oil. For those persons who are very, very dry, as you saw in the beginning, you can put it in oil, or for instance, the rapeseed oil, and then you can put it around in the mouth with the wipe. And you can use it for fluoride solution to apply on the teeth, and you can use it for those who are in late stages to taste, for instance, coffee, tea, wine, or whatever. Just to get the taste, if they are get parenteral nutrition, because it doesn't taste anything, so you can use that. And I got the idea from someone once. He asked, "Can I use it to whiskey also?" I said, of course you can. And you can also do, if a person is in the late stages, you can put this in water, and then you put it in a plastic bag or a plastic box, and you put it in the freezer, and then you get like an ice, and you can take it in the mouth to feel more comfort. So it's very, very good. But something that is important, you shouldn't use it many days. It's for one time. it's not a product that you have for many days, because perhaps it could happen something with the wipe, and it could loosen from the grip. So don't do that. It is for one time. That's something that the producer really says. Here is some things that you can use for dry mouth. As I said before, rapeseed oil. There are many, of course, you have different kinds of those things in your countries that could help persons with dry mouth. If you go to the pharmacy, I think there have a lot of different kind of products that you can try. For it's important not to be dry in the mouth. And we have done an oral care program. We started to make it in Swedish. Then we translated it into English. And after asking from, what is her name in Germany?
Michaela?
Michaela asked. And then we translated it also into German. So this program is in 3 different languages, and we think it's very good to take it. You take it with you to the dentist, and then you can read about Huntington's disease, and you can also read about things that make it easier for the treatment and what to think about, such as the swallowing problems, to think about the positioning and so on.
And this is on your webpage, or where
Yes,
can people find this?
It is on the web page for our Huntington's organization in Sweden, and
so when we put this recording of your talk now today on our webpage of the European, we should have this link together with that, so people can find it, huh? Mm.
Of course, and you can also order it from us in Sweden, so you get because if you you can print it out from the website, of course, but then you don't get it as a pamphlet, then you get it as a side, several sides, sheets, but you can order it from us, so we will take that afterwards.
Great.
And what is good, it's very good to think about the positioning. This woman, she had this special thing in her wheelchair, so she wouldn't slip out from it. And we took it from the wheelchair and put it in our treatment chair while we were treating her in the clinic. It worked very good. And this is anti-slip that the person can sit on, so you won't slip out. And of course we use these cushions, Tumle dental cushions, in the dental clinic also, for persons who have a lot of movements. Of course they don't work so very good, but for those who don't have so much, they have a little movements, they get relaxed when they lie in the chair. Of course not so very long, much back, a little bit up with the back, and they get relaxed, and they feel very comfortable and very steady when they lie in those cushions. And there is the website you have where you find those cushions. They are fantastic. This is just for you to remember. The daily care is important. It's the most important thing. It's the daily care. So, do you find any reasons why we should care about oral care? You can't pretend that it isn't there. Or what would we do without our mouth? We need it, and we shouldn't forget it. neither our mouth, of course, and the persons with ADHD. To have a good quality of life, I think it's very important to care about oral care.
Sure.
I think this was the end.